أعوذ بالله الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So today, in our third lesson of this course, that is the principle of environmental health, we shall be talking about environmental policy and regulation. And this is one of the most important area of this course because this lesson covers all the areas of environmental health. So this lesson is very comprehensive because when you're talking about rules and regulations, we are basically talking about guidelines that guide, the environmental health in general, you know. Now, as we start, we always start with the lesson objectives. So these are the objectives that will be driving our lesson today. So by the end of this lesson, you should be able to, number one, explain core environmental health principles. Two, analyze an environmental policy or regulatory framework. Three, assess risks and evaluate the effectiveness of an environmental policy. Four, identify a global and a local environmental health challenge. Then lastly, propose an evidence-based policy solution for a given environmental health issue. So in brief, this is what we shall be discussing in our lesson today. Now, number one is a brief introduction to environmental health policy. So what do we mean when you're talking about environmental health policy? And this word policy is related to law, but there is a difference between law and policy, as we shall see later. They are not the same. So when you're talking about law, it's qawanin, and policy, they are siyasat. So what is environmental health policy? So environmental health policy involves, so policy is general and law is specific. Law is inside the policy. So environmental health policy involves laws, al-qawanin, and guidelines, irshadat. These two have been created. Why? To prevent disease and promote healthy environments. So environmental health policy, it connects science with decision making. And when this is a very important point. So when you're talking about science, as we saw in our last lesson, we are basically talking about research. That is, you cannot make a decision without research, which is the science. So the research provides what? The research provides information, and with the information, you can make the decision making. So you cannot make a decision without science. So the science gives us al-ma'lumat, and this ma'lumat, we use it في اتخاذ القرارات. Now, and the main objective of the environmental law is to do what? Is to prevent disease. And I always use the time of Corona, for example. There were a lot of policies that many governments around the world, they passed policies. So those policies were to prevent the spread of Corona. And also those policies were aimed at promoting health environment. So we have some examples here. For example, laws limiting air pollution from factories. Because if we don't have a regulation for the factories, they are going to pollute the environment. If they pollute the environment, people are going to get respiratory diseases. Regulation ensuring clean drinking water. Also, urban planning policies to reduce overcrowding. If we don't have a good policy of how houses should be constructed, the spacing of the houses, you'll end up getting a lot of diseases. Number two, so we are through with the definition. Number two is environmental risk assessment. So what do we mean by environmental risk assessment? So this is a process, al-amaliya. So this process is used to do what? Number one, evaluate the potential health risk from exposure to environmental hazards. So this assessment helps policymakers understand. When we are talking about policymakers, we are talking about the Ministry of Health. We are talking about the legislature. We are talking also about the executive, because they are the ones who normally make the policies. So before they make any decision, this assessment helps them, to understand the dangers and decide how to control them. So it includes, we need to identify al-makhatir, the hazards, we measure the exposure and estimate the risk. Now, for example, assessing health risk of contaminated water. This is the work of public health specialists. You will go and assess the water, the level of contamination, is it manageable, or if it is not manageable. Studying exposure to toxic chemicals in farms, the use of pesticides, for example. Then evaluating air pollution impacts in cities. Now, the most important thing is that, remember in our definition, we have said that environmental risk assessment is a process, هي العملية. So this process has 4 steps. Number 1 is identification. We identify the risk. Number 2, we analyze the risk. Then number 3, we evaluate. Then number 4, we manage. So this is what public health specialists normally do when it comes to what? When it comes to environmental risk assessment. Now, let us put this into practice. So, for example, if you look at the picture, what is happening? There is some waste disposal. And this waste disposal is doing what? It is causing, so this waste disposal, it has a risk to children, to people living around the place there. So if we apply the environmental risk assessment, this is what is going to happen. So number 1, at Tahdid, we identify the risk. What is the risk? So we have to determine what hazard exists and who could be harmed. So this waste disposal, what kind of hazard is there, and who is going to be exposed to this? So, of course, we are going to have the leachates. This is the toxic liquid from rotting waste, contaminating the groundwater. So, burning waste, releasing dioxins, ila ghayri dhalik. So, this waste disposal, it's going to affect who? Children playing. If children come and play around this area, they'll be affected. Residents drinking, if there is a water source here also, it will be affected. And waste scavengers. Waste scavengers are animals that actually eat from the waste disposal. Now, so once we identify, so already we have identified the risk, and we have also identified the people who are going to be affected. Number 2, we analysis, tahlil. So this is where we study how this exposure happens and how severe the harm could be. So what do? We study how the exposure happens through what? Waste. So we have, this is the waste. So if it rains, the rain is going to carry all this waste to what? Rain washes toxin into soil. Then it can also contaminate shallow wells. That is the water sources. And the children are going to drink the water. So that is how we analyze the exposure and how severe. Severe, it basically means the magnitude, darajatul khatar. Then after that, we evaluate. So decide if the current level of risk is acceptable or needs action. So we ask ourselves, Ya Jama, is this risk high? Is it moderate? Or is it low? If the risk is high, that is unacceptable, then we need immediate intervention. We need a solution, because this thing cannot stay like this. So we need to find an effective way of handling it. But if it is minimum or moderate, then we can see how we can handle it. Then lastly is to manage. So we implement controls, monitor, and communicate with the community, which is very important. So this is where we have the actions. So we relocate the waste dump. We can relocate this. So we can find a better place, maybe somewhere that is far from the residents, okay? Or we can install a sanitary landfill just around the waste disposal, or we can provide piped water around, or we can ban opening. We can ban open burning. Then we can also start a community recycling program. So this is what is meant by what? Environmental risk process. And this is just one problem of waste disposal. But you can have a lot of problems in the society. So sometimes it can all be about, for example, people are polluting the water. For example, it can maybe be related to housing. It can also be related to the kinds of food we are eating. So there are very many environmental risks that needs to be assessed. Okay, on to our next point. Our next point in environmental health, there is what is known as air quality, pollution, and regulation. So we normally have the cars polluting the environment, and sometimes we normally ban the waste, which also does what? Pollutes the environment. So when it comes to health environment regulation, we need to come with a policy that is going to ensure that the quality of the air in our environment is at an acceptable level, and we have to come with a regulation that is going to help us minimize the air pollution. Now, so what is air quality, pollution, and regulation? So these are rules, al-qawanin, and standards, al-ma'ayir. So these rules and ma'ayir, they are designed, limada. Why? To control air pollution and protect public health. So what do governments do? الحكومات ماذا تفعل؟ تحدد. They set the limits on pollutants and monitor air quality. So they set the limit. So if they come and they measure, they find that you have transgressed above the limits, then you can be taken to a court of law. So poor air quality. Now, if we don't regulate the air, what is going to happen? Poor air quality leads to respiratory and cardiovascular diseases. That is why it needs to be limited. So what do we limit? Emission limits for vehicles. We have to limit the emissions from the vehicles. Ban on burning waste in urban areas. This burning of waste in urban areas should be actually restricted and should be banned completely. Because in the urban areas, we have people live in urban areas. Then air quality guidelines from World Health Organization. So even the World Health Organization, during your free time, you can go and research more. They have guidelines of how we can protect the air. Okay, number 3, we have a regulation to regulate the air quality and to monitor. The same thing applies to what? The same things applies to water quality and sanitation policy. So water is a determinant of health. If we have people living in a town and they're getting good water and the water is not contaminated, then they're going to have good health. Well, sahih. If you are living in a place where you are getting water, but the quality of water is not good, it is contaminated, what is going to happen? You are going to get diseases. So that is why we are saying that the quality of water determines the health. So it's one of the most important determinants of health. So when you're talking about water quality and sanitation policies, we are basically talking about what? These are policies ensuring safe drinking water So these are policies that ensure that the water we are drinking is safe and also proper waste disposal. So by proper waste disposal, it basically means that people are not polluting the water sources. Because if they pollute the water sources, what is going to happen? We are going to have infectious diseases. So clean water and sanitation, this is what we were just saying a short while ago. Clean water and sanitation prevent what? Diseases like cholera and diarrhea. You know? Now, policies regulate water sources and sanitation system. For example, we normally have the chlorination of drinking water. You know, also another thing is building sewage system. Then we also have public hygiene campaigns where we can have workshops, seminars, and these campaigns are aimed at spreading the awareness about the importance of actually ensuring that our water, the quality is that good. Now, also related to environmental health, policy and regulation is what is known as waste management. So in our countries, especially in Africa, we don't have enough policies related to waste management. And if the policies are there, they are just cosmetic. They are not being implemented. So the net effect is that you are finding that people are just disposing waste the way they want, ashwaia, and the end result, we find that there is a lot of diseases in our community. Now, when you're talking about waste management regulation, these are rules governing number one, the collection, jam. Then treatment. And three, disposal of waste. So here we have three important things. So in our cities, in our countries, do we have policies to collect? That is why in many countries, you normally have, in fact, the private sector, they're very good in that. So the households, they normally pay $5 every month. So there will be some lorries, pickups coming to the houses and collecting the waste. So that is one of the prudent ways we can actually use. And many countries are applying that. So this is the collection. Okay, halas, we have collected. Now, how are we going to treat this waste? Does this waste need some treatment? Then akhiran disposal. So where are we going to dispose this waste? Now, improper waste management, if we don't actually dispose the waste in an effective way, it will lead to pollution and disease. So policies promote safe disposal and recycling. You know? So for example, we have waste separation at source. So the place we are dumping, the waste, we separate them. This is what you see here. So we put papers in one place, the glasses, we put the glasses in one space, the plastic in one place, and the metals in one place. So this is what is meant by what? Waste separation, which is very effective in the developed countries. Then also, we have the recycling. So you can see from the other pictures. So we normally have, for example, the plastic bottles and containers. They can be recycled again. So this is what happens. You just drop it. And in some countries, you have a machine to recycle the plastic and plastic waste. Then safe disposal of hospital waste. So also the hospital, they have to ensure that they have, strategic places to dispose their waste, because most of the time, the disposal from the hospital, they are always contaminated, they are always toxic. So the way we dispose the hospital waste, we need to dispose it in a place that is far far, far away from where the community, from where the children are playing. If it is possible, it needs to be banned, you know. So that is all about waste management and regulation. Now, another thing related to environmental health regulation and policy is what is known as chemical safety and toxic substances policies. So sometimes we normally have people working in companies, people working in industries, and we also have the medical practitioners working in hospitals. So it's very important for those people working in areas where they can be exposed to chemicals to always wear the PPE. You know, so the personal protective equipments or the gears are very important so that you don't get exposed to the toxins, you don't get exposed to chemicals that can affect your health. Now, what do we mean by chemical safety and toxic substances policies? So these are policies that regulate harmful chemicals to protect human health and also the environment. So you are not only protecting yourself, but you are also protecting the environment. So chemicals can enter the body through many ways. Through the air, you know, we can breathe in we can breathe in chemicals. Through water and food, we drink and eat. So sometimes we can drink toxic liquids, and eat foods that are contaminated or poisonous or food that has expired. So regulation controls their production, use, and disposal. How do we produce these chemicals? Do we use them? And how do we dispose them? So, for example, we have pesticide regulation in agriculture. How should we use the pesticide? Of course, the pesticides, it helps us do what? The pesticides, it basically helps us increase or improve our productivity in agriculture. But also it has some darar. If we don't use these pesticides effectively, then it is going to affect the plants also. And we eat those plants, so we are going to get diseases. Then we have to bans on harmful substances under the Stockholm Convention. So the Stockholm is in what? Is it in Norway? This is a convention in Norway, I think, or Sweden. But also in our countries, we can have policies to ban on harmful substances. You know, then number 3, safety labeling on chemical products. So we can label, you know, and at the same time, so when you're talking about labeling, these are the times we can label, we can have in our buildings, in our working environments, labeling. These labelings, they help a lot. So you get to know there is danger, you have to know it's a high voltage thing. So these labelings are very, very important. Now, another important thing related to environmental health policy and regulation is climate change and health policy. And this is one of the most important areas in the 21st century because we are living at times where the environment is becoming unpredictable. The climate pattern is very unpredictable. So it is not like a long time ago where we used to know, wow, in March, April it's going to rain. Then in August, it's going to be summer. Then in December, it's going to be winter. But now the climate is changing. Now, and this climate, the change is being caused by us, the human beings. We are the main reasons why the climate is changing. Why? Number 1, we have the deforestation. People are cutting a lot of trees. And if you cut a lot of trees, you are not going to have enough rain. If you don't have enough rain, people are going to die from droughts, and so that is one way, deforestation. Then, when you're also talking about climate change, the industries, the factories, they do what? They release a lot and they pollute the environment a lot. So these are some of the factors that affect the climate change. Now, when you're talking about climate change and health policy, these are policies addressing the health impacts of climate change. So التغيير في المناخ, does it have any impact on our health? Yes. How? So climate change affects health through heat waves. So for example, during summer, when the sun is very hot during summer, do you know that it affects our skin? The rays can affect our skins. Then also there are some diseases that can spread. For example, when it rains a lot, what normally happens when it rains a lot, you are going to have what do we call it? We are going to have what? The name. We are going to have these choleras, the malaria spreading a lot. Communicable diseases, yeah. Then we also have food insecurity. For example, if it is very hot, not raining, we are going to have food insecurity. We are not going to have enough food. If we don't have enough food, what is going to happen to your health if you don't eat enough food? Your health is not going to be well. You're not going to be okay. So food security or food is also a determinant of health, So for example, we have renewable energy policies, we have flood protection system. For example, in many countries, when it is raining, do you see the red thing here? So in many countries, they normally put the red thing in towns, such that when it rains, the town is not flooded. Because when it is flooded, it's going down the stream, and the drainage system. We're going to have a lot of water. And these lots of water, diseases, infectious, carries diseases with it. Then also, heat wave response plan. Of course, you have to use the umbrella to encourage people to use umbrella when you are designing your town. When you're designing any town, you always have to ensure you have some sheds where people can sit when it's very hot. But unfortunately, in Africa, you don't have a lot of sheds. You can walk in a town for many hours even. You'll not find a shed. You'll not find a tree. Okay. Wow, this is also related to, so the occupational environmental health is somehow related to what we were talking about, chemical safety. They're somehow related. So when you're talking about occupational environmental health, we are basically talking about, is closely related to the what? It's closely related to the chemical safety and toxic substances. Because the occupation basically means the engineers, the doctors working, and as they are working, they're exposing themselves to a lot of chemicals. So to avoid the risky, whatever, exposing themselves to these toxins and chemicals, then they have to wear the PPEs. So when you're talking about occupational environmental health policies, protection of workers from environmental hazards in the workplace. So here we are not only talking about health workers. Here, protection of workers, it can be teachers in schools, it can be doctors in hospital, the nurses, it can be engineers in the construction companies, إلى غير ذلك. So it's not restricted to only health workers. So workers may be exposed to chemicals, noise, and safe conditions. So regulation ensures safe working environments. So that is why you have to use of protective equipment like the gloves and the masks. All these are protective equipments which are very important. limits on workplace exposure to toxin, then factory safety inspections, which is very important. So we need to have a regular inspection of where the workers are working. We need to have inspectors from the ministries working around. We have to have companies and industries being given licenses and permits for compliance. If we don't do that, then we'll have a lot of cases. Now, we also have the issues. One thing now is also related to environmental justice and equity. So another important thing in regulation is something that is related to al-adala wal-musawa. So we normally have, if you look at the picture, we have the rich get richer and the poor get what? Get their byproducts. So the rich people, they live up there. Can you see up there? They live up there in the industries. And these rich people, what happens to their industries? They release the waste products to the masakin who are living down there. So when we have a health policy, the health policy should ensure that such things does not happen, because all the people, they have the right to live. They have the right to get fresh water. The air they are breathing in should be good, of good quality. So we should not have a situation where we have the masakin and tujar and aghniya in one. They're not in the same level, you know. So fair distribution of environmental benefits and risk across all population. We are all the same. So the benefits should be the same. And if it is the risk, all of us should face the risk. So some communities face higher environmental risk due to poverty or location. So sometimes they are masakin, where they live is not that good. For example, they live in slum areas, you know. So policies aim to reduce these inequalities. So for example, providing clean water in rural areas, reducing pollution in low-income neighborhoods, then inclusive policy making. And this is one of the most important things. And in our next lesson next week, we shall be talking about stakeholder engagement. And we shall talk more about inclusivity, because we have many people living in a country. So before you come with any policy, you need to engage, you need to ensure that each and every person has raised, each and every person has taken part in the policy drafting, implementation. Now, lastly, we have the global environmental health governance. Now, when you're talking about governance, we are talking about al-hawkama. Now, international cooperation to address environmental health issues. We have cooperation like the Paris Conference, Paris Agreement. We have a lot of cooperation between the countries to ensure that we have good our environment is safe. The World Health Organization is playing a leading role. Also, the United Nations Environmental Program, and we also have the International Climate Agreement. So all these agreements play a big part. Now, lastly, it's all about policy implementation. How do we apply? Now, Khalas, we have the policies, but sometimes you can have very good policies, but al-mushkila fi tatbiq. Or sometimes the problem is in the enforcement. You can have very good laws, but people are not following. So the process of putting environmental policies into action and ensuring compliance, this is the most important part. How can we ensure that the population, they are following the rules and policies? And if they don't follow, what are we going to do? So that is why policies are effective only if properly enforced. Governments use inspections, they fine, and they have their monetary systems. So penalties for illegal dumping. If you dispose your waste here, the government fines you. You'll be fined, or they can take you to a court of law. Sometimes there is environmental inspections, monitoring of إلى غير ذلك. Then community participation and awareness. This is what I was talking about. Next week we shall talk in detail about this. The involvement of the public in environmental decision making is very important. So I will not explain more about this because next week we'll talk about this. So that is the end of our lesson. So for more information, you can read this YouTube. There are a lot of information about environmental policy, regulation, and law. Now we still have one more lesson. Next week will be our last lesson. We shall be talking about the role of stakeholders in environmental health. Then I've sent you an assignment in your group. So you'll be doing the assignment. So it's an individual research assignment. This assignment should be submitted by next week on Thursday, and you have to follow the instructions that have been given. I've given lots of instructions. So just read the document and follow all the instructions, okay? Those instructions are very important. And the research has a weight of what? 20 marks, okay? Now, and that is the end of our lesson. If you have any question, please, you can ask. So I'm going to send the attendance. Some students, they don't take the attendance. And the attendance is 20 marks, really. So ensure you take the attendance. So I've shared the attendance in your WhatsApp group. So please take the attendance, and we still have one more lesson next week before the end of the course. So if there is no question, we'll meet next week, inshallah. As salam.